reminder, we are recording this video for future use. COVID-19 in Arizona, we have 842,000 plus cases in the state, over 16,000 deaths. Some charts and graphs to look at that, along with the information on the resources from which we're pulling those. ADHS data. At this point, we're going to jump over really quick to the ADHS website and look at the specific information on that site of where we're pulling this. So if you go to the Pima County page, look at data and reports, you've got these 5 options for reports. Please note that the Pima County Health Department is no longer doing the colored infographic here on this page. But once you click the ADHS schools dashboard, it's going to take you to this page right here where you can pull out Pima County and then give you the overall data for the county as it applies based on the indicated week and the time frame listed above here. So you've seen we've had a small uptick in cases. One of the reasons we believe that's happening is because of what seems to be a loosening expectation around mitigation. We're seeing a little bit more resistance to mask usage. There's a proclamation that was issued recently saying that masks are no longer allowed. The county has very clearly stated that masks in Pima County are mandated, and there are some legal grounds for that statement. So we can share that out with everyone in the group. But that is a concern, and the emergence of variants in the county is an additional piece to that. So short message, please continue to practice mitigation. Please ask your communities and your parents to continue mitigation outside of school, because if we don't continue mitigation outside of school, we're going to start seeing numbers jump up again. The percent positivity, remember, this is just as per antigen testing at this point in time, I believe. So there's a large amount of tests that are not included in this data representative, but we're at 2.6% positivity. And those numbers will change if you increase the other, or if you add in the other types of testing available. So jumping over to Pima County graphs, this gives you the total cases, total deaths. Again, this tool allows you to break down the information by school district, jurisdiction, census tract, or zip code. And you can see the changes in these graphs reflected by each of these. One important part of this that I think is really helpful is down here, the cumulative cases. I can pull this out and then do this by date as well to see an overall trending graph of where we are for cases by date. Helpful tools overall. So here you can see that we do have the total of 112,000 plus cases in Pima County at this point in time. There's been 2,341 deaths. Pima County testing data tests overall, the percentage of people that are testing is continuing to drop. We do have a call to folks on this call today around Binax testing and what that means. So we'll do a little bit of information sharing on that, and a upcoming webinar tomorrow on Binax testing and what that means. Pima County long-term care assisted living charts, so you'll have access to these slides as well. This just shows the overall trends for those communities, which are really important in terms of the effect of COVID as it applies to mortality and morbidity within our community, as well as the hospitalizations and ICU beds and ventilators. We're not going to cover a lot of that information in this meeting, but it's good overview for you all to peruse and look at when you're back with your on your own time. Overall, K through 12 cases and outbreaks, our subject matter experts on this are Tiffany Jones and Stuart Slonaker. You can contact either one of these individuals for more information in relation to this specific content area. So for the dates of 8/5/2020 till 3/30/2021, we've had a total of 3,715 cases, 64 total outbreaks. There is one potential outbreak that we're currently investigating today. On this note, I do want to make a quick call out to just suggest that you know, we recognize that there's COVID fatigue and change fatigue. Those things are very real, and the experience that a lot of you have had. Some of the things that we're concerned about is that people are not reporting cases and they're not testing if they're COVID symptomatic. So in regards to Binax usage, it's going to be really helpful for you to get blanket permission for conducting Binax testing on site for any symptomatic for that symptomatic screening tool. That's going to be super helpful for a lot of reasons. The other thing around Binax, which we're going to get into a little bit later, is the ability to look at positive and negative predictive values. And I'll talk more about what that means towards the latter end of this presentation, as well as give out the information for the meeting happening tomorrow. That's really just about Binax testing and how to reintegrate that into your school. Information on variants. This is pulled directly from the CDC. Currently, we have 95 of the UK identified variants, 5 of the Brazilian variants identified in the state of Arizona. From TGen, which is our Arizona COVID-19 sequencing dashboard, you'll see the link right here at the bottom of the presentation to access information. This is a cumulative assessment of all of the screening that is being done around genomic screening for the state. Currently, the health department here in Pima County is sending between 50 and 60 randomized tests daily, or weekly, up to the state in order to screen for these variants. So you can see 19% of those are reflected here in the overall distribution of those genomes sequenced across the state. We are pulling someone from our testing team next week to go over this information in a little bit more detail, so this is important. And I will address those questions in a little bit because there are some important, really, really important points on that negate some of what is being dropped in the chat around that. Again, I invite you to review this on your own time regarding the sequencing, and then send over any questions you have in regards to those. We do know that in Pima County, we have identified some of the variants, the UK variant being one of those. So, you know, just know that it's around and the potential for spread is really high. So this layered mitigation piece, and that's where we come back into this idea of layered mitigation, is really key. And as we decrease the physical distancing to the allotted 3 feet for students, the symptomatic presence, students who are symptomatic on your site, it's really important to get those students moved into quarantine and isolation as quickly as possible, which is where, again, this Binax tool is extremely helpful. Over 85%. So if you have 100 students that are symptomatic, 100 staff that are symptomatic that come onto your site, you can get 85 or more. Most likely it's 85 to 95 of those students identified immediately with a Binax test, which means you immediately move them into isolation. If you're in high school and middle school population, that's going to allow you to do very rapid contact tracing. In other words, you'll be able to identify close contacts in a very rapid way because the recallability over a 15-minute period, it's much greater than a 3-day period. So again, we highly recommend the use of Binax at your school sites at this point in time. Getting more into the details of prevention here, excuse me. The graph on the bottom right illustrates as concisely as possible the details of the recommendations on physical distancing. There's some issues with this, and I definitely can relate to what you're going through, but it's really important that I talk through this and make it really clear as to why some of the positions are the way they are. So the CDC allows for 3 feet physical distancing for students. That's anyone 18 and under at this point in time, anyone who's considered a student up to senior level at your high schools. All adults have to maintain 6 feet. So that includes teacher to student. There has to be 6 foot physical distancing there. And teacher to teacher is 6 foot physical distancing as well, okay? So those are important points. The third important point, and I know this is controversial, and this is a pain in the butt, and I have no other way to give this to you, but the CDC is not going to change the definition of close contact at this point in time, and we have the county will not go against that guidance. So when you're reporting close contacts, you need to make sure that anyone who's under 6 feet is considered within that close contact. There are strategies that you can integrate to do this. Now that we're down to 3 feet, that's going to increase the number of your close contacts in your classroom. But again, that's where this Binax is going to be really helpful to quickly identify those individuals and move them into quarantine so they can get reduced quarantine, 5-day testing, post-exposure in a quick way. And that's going to expedite a lot of the movement of quarantine, as well as just keeping your population safe. I understand that that is going to be an enormous challenge. One of the recommendations that we we think would be helpful is using some of the extra funding coming out of COVID funds to hire nursing staff to assist with this. And the health department is currently looking at ways to supplement that funding as well. I'm not confident that we'll be able to attain that at this point in time. The quickest way is to use those state-issued funds and the federal-issued funds for school nursing and the administration of Binax, as well as the conduction of contact tracing, at least the initial investigation. If you can get us the names and the phone numbers and the date of births of individuals, then we can conduct the rest. And we are looking at changing some of what we're doing within our Qualtrics form for those of you that are reporting to enable things to be a little bit more concise. Continuing the PCHD prevention guidance for hand washing, respiratory etiquette, contact Kristen King. For cleaning, maintaining healthy facilities, contact Stuart Slonaker. Dixie Siegel is our resident expert on ventilation. Contact tracing, isolation, and quarantine, experts Tiffany Jones and Sylvia Vasquez. Please, please, please make sure that those things continue. Just to address a quick question in the chat. Did you say that a student who's quarantined can now get out after 5 days with a negative test? Great question. On day 5, you can take a test. If that test result is negative, you are released back into the classroom after day 7. So that's an important clarification. And I also need to make sure that the difference between quarantine and isolation is also understood. Isolation is just for positive cases. It's 10 days blanket. There is no getting out of isolation early. Quarantine is for close contacts who are exposed to confirmed positive cases. Those individuals can take a test on day 5. If that test is negative and they have no symptoms, they can get released by day 7, which means they're back in the classroom by day 8. So thank you for bringing that up and making sure that I clarify that point. Continued prevention guidance. Testing for indication and screening. Our subject matter expert on this is Kristen King. This is where we're going to talk a little bit about the session tomorrow. So tomorrow at 9 a.m., we're in the process of doing this invite, and we'll do another one next week as well. We're going to go really deep dive into the details of Binax. And we had a conversation, I think it was 2 days ago, or maybe it was yesterday. I can't remember when it was. It was 2 days ago. We met with the Delaware Public Health Department, which are using Binax to do screening testing at school sites. And they're getting some really good data out of that, but more importantly, they're finding rapid ways to move into quarantine and isolation, which is helping reduce community spread within school systems. That is a recommended CDC strategy, is to use testing to do that. Their screening testing includes 10 to 15% of populations at school sites. There are a lot of logistical implications with that. So we want to help out with that, and we want to try to make whatever resources we can available to ensure that that is a strategy that you can integrate at your school sites. So the session tomorrow is geared towards administrative staff, principals, legal, folks who are involved in the actual implementation of Binax at the policy and systems level, as well as school nurses, the folks that are actually conducting the test and entering the data into the system. There are some really easy ways to do that. We understand that there's been time constraint issues around the entering of Binax data post results. And there's some tricks you can do to decrease that time. Yeah, Kathy, so I'm gonna talk about that at that session tomorrow. The most important thing that we're gonna note with that, Kathy, is what I mentioned earlier, that the negative and positive predictive values for large populations in terms of screening, this is a really helpful tool to do that. And one good metaphor for that would be BMI. BMI used in individual capacity isn't a very useful tool, but when you start to use it to look at larger aggregate populations, it becomes very useful to look at population health. So this test is a great way to use that in a synonymous way. And as Kristen is as Kristen's posting in the chat there, tomorrow at 9 a.m. the invite will go out to everyone on this webinar as well as our Tuesday webinar, and we will run another one again next week as well. So just know that those things are coming up. Okay. Yes, shameless plug. Before I move on, Tiffany or Kristen, that was one of the things I needed to cover. What was the other thing that I needed to cover today?
Graduation.
Yes, thank you. We'll be on that here in a second. Okay. For the couple questions popping into the chat, I'm going to note right now. So AZDH guidelines state symptomatic and test negative by PCR antigen, only home 24 hours, etc., and symptoms improved. Binax states if negative, need to go get PCR. This makes it difficult. Okay, yeah. So I think the important thing to remember that is out of 100 tests that you're going to conduct, 15 of those are going to have to follow that PCR guidance. So, you know, vast majority of those. And when you couple in the fact that if you have students that have seasonal allergies that are documented, that when they present to the health office with those symptoms, even though those symptoms are COVID-like, you can effectively just take that symptom documentation from a healthcare provider and say, okay, this is just seasonal allergies, you're good to go. Okay, so those are two things to remember to address that question, Sherry. I hope that
and
helps.
Brian, to follow up on what you were talking about there, we're going to go into more depth on that tomorrow in the meeting and how those data points do change based on our levels of community transmission. And we have Fagan nomograms and other data sheets to show that and you know, establish that as few people as possible will actually need that PCR follow-up, even though it can be inconvenient, as you're talking about.
Yeah, and that's something that we have not done a very good job of communicating overall. So we're going to do a real deep dive into that tomorrow. And then again, next week for anyone who may not have the ability to join us tomorrow, that'll be tomorrow at 9 a.m. And again, look for an invite to come out from us to this group before close of business today. Okay, any idea when Pima County vaccination sites will open to 16 years and over without the designated medical conditions? By next week for sure. I know we didn't want to open up on April Fools, so that was one reason it's not happening today. But we'll get back in touch about that, and we'll make sure that there's still, it hasn't been a solid date, but it'll be posted on our website as soon as it does. Fully post-vaccination prevention. This is a slide we've gotten a lot of questions about, so we wanted to put some detailed guidance on this. And I also want to specifically mention travel because that's been a question that's come up recently as well. So you are fully vaccinated 2 weeks after your final dose, whether it's J&J, which is 1 dose, Pfizer or Moderna, which are the 2 doses. After 2 weeks, then you are fully vaccinated. When you're fully vaccinated, you can gather indoors with other fully vaccinated people without wearing a mask, okay? Think mostly like your social interactions. So if you know other families that have full vaccinated, so on and so forth, you're good to go, with the exemption of the fact that if any of those individuals live with an individual who has an increased risk for severe illness from COVID-19, then we recommend you wear a mask at that point in time. So this is just really good opportunity for communications within the populations that you work with. If you've been around someone who has COVID-19 and you're fully vaccinated and you've been in close contact, there is no need to get tested. There is no need to get to go into quarantine unless you have symptoms. So if you have symptoms, then at that point in time, it is recommended that you take a test because it could potentially be a breakthrough case. I believe we've had 3 of those at this point in time out of all of the vaccinated cases, and all of those, it's been asymptomatic. So that's good news overall because it's less likely to spread. But yes, if you're fully vaccinated and you have symptoms, please go seek testing, which links into the what hasn't changed, continue doing these things. Now, on the CDC website, travel, because spring break is coming up and spring break has already elapsed, travel's been something that's been pulled out and called out as what do you do when you're fully vaccinated and you need to travel, because the CDC recommends quarantine for 14 days post-travel. If you're fully vaccinated, you do not need to do that, okay? Only individuals who have not been fully vaccinated should seek quarantine after travel. Okay. And you're eligible for reduced quarantine, which refers back to the previous question of take a test at day 5 if you're not symptomatic, and then you can return on day 7 or 8. Okay. A couple other questions coming up here. Thank you, Kristen, for getting that one. Leslie, I think I'm going to read both of these out loud for anyone who doesn't have access to the chat. Any idea when we will get more information on how long the various vaccine lasts? Lots of info in the media, and we are getting questions on if people have to get a booster after 30 to 90 days, depending on the vaccine they received. Answer to that, research on vaccine efficacy is still ongoing, and unfortunately, we do not have any additional information yet. We do expect it soon, though. Boosters are being investigated currently, and we will update as soon as we have more information in that regard. Stuart did post the link to how long the vaccine lasts in the chat there as well, and that's directly from the CDC. Can we take parental word for onset of allergies? No, according to the state, you need medical documentation. So there has to be a previous documentation from a healthcare provider. If you have that documentation within your electronic health records or whatever health record systems you have at your school site, and the parent says, yeah, check their records, and it's in there, then we'll take that as an acceptable format for that documentation. What we want to avoid, though, is all of a sudden, little Brian has symptoms and tells the school nurse, oh yeah, well, my doctor just diagnosed me with seasonal allergies, although I've never had seasonal allergies before. I'm just getting them now to avoid quarantine and isolation. I think you get where I'm going with that. So there you go. And Stu put in a good point here. Please encourage parents and families to include allergy information on health cards. Almost done, moving through this rapidly. This is an overview of distribution of COVID-19 vaccine from the federal, state, and county vaccination partners. We think this is important because we have gotten questions about discrepancies between the various systems for which you have to, what is going on here? Sorry. Holy cow. Yes, confirmed, sure. Sorry. Distribution of COVID-19 vaccine. We've had questions about the federal deployment pod, the state-run pod, and the various pods that the county is running. So the federal pods are your Walgreens, CVS, Albertsons, Fry's, Safeway, but those are also administered by the state as well. And I think the best way to look at that is to just go to vaccinefinder.org, and that'll get you tied into federal and state pods. Federal pods usually fall under the state registration system. So if and when the federal pod does come to Tucson, to Pima County, it'll be through the state registration system, AZDHS, where currently that's where you're going to register to receive your vaccine at the U of A pod, which is a state-run pod. All of the other pods fall under county vaccination partners jurisdiction. So you've got your TMC pod, your Banner pod. Those are all county-run pods. There's also mobile vaccination pods, which a lot of your schools have been volunteering and assisting in the deployment of vaccines at those sites. So that's kind of like the layout of how that distribution goes. And then currently we are just jumping into 1C here very soon. So you should see this in the next couple of weeks. A couple of questions popped up in the chat. I'll get to those in a moment. Just want to point out we're over 85% at this point now for K through 12 staff that have received their vaccination to date. Side effects are minimal, indicating healthy responses if you do receive side effects. This overall, the big key with vaccines, you're going to reduce overall hospitalizations and deaths, mortality and morbidity associated with COVID-19. And that's why we're seeing a drastic drop off in some of those rates, is because of the number of vaccinations that are being administered in the county. All right, time to get to the chat. Here we go. Ms. Steinley, absolutely. Family just relocated from India. They're absolutely eligible for the vaccination if they fall under the age guidelines. Unless they're 18 and under, 16 and over, we'll be jumping to that's very, very quickly here. Do you know why you currently not schedule a second appointment at TMC? I don't know. I'm guessing that's through my chart. There should be an auto scheduling function. I'll check in with Vaccine on that. If there's issues with that, that may require a quick phone call with you, Ms. Miller-Hilden, just to kind of clarify what the ask is there. I might ask you to unmute here in a second if we have time. If we have a student that we've treated for asthma or seasonal allergies in past years, do we still need documentation from a physician? I think as long as it's on electronic record, health record, or on health record on site at your area, I would offer that is a potential exemption, but that is a district policy decision. So please refer to your district policies in reference to that question, because that's what's going to tell you the most. For those of you on the call that are in positions for districts, one really important thing: water fountains. We're getting into hot weather. Please turn the water fountains on. The health department is no longer looking at water fountains as a high-risk transmission source. So there are etiquette things to consider with water fountains: distance between students as you do so, wiping down in between, or even something as simple as just a quick distribution of hand sanitizer before water fountain use. But please, please, please make sure your students are hydrated. If water bottles are something that you want to look into, I believe that's something else that your COVID funds can be used for as well. Okay. Last question from Miss Carolyn here. If someone is 2 weeks post second dose vaccine and they present with symptoms, are we referring for an immediate test so they can return, or are they waiting the 5 days to be tested? Any symptomatic, immediate testing. Okay. Anyone who's symptomatic, immediate referral to testing, and that's PCR test. That's another great place, though, for where your Binax cards are going to come in really handy. So if you get someone presenting symptomatic and they're fully vaccinated, you can run a quick Binax test right then and there. If they're negative, again, you will have to refer to PCR, but you're going to catch 85 out of 100 of those individuals in that space, okay? Can you provide testing guidelines protocol for turning fountains on that have been shut off for months? That's a great point. And that also ties in with one last quick thing. So I know our health inspectors have been going out to school sites to conduct annual investigations. This is a part of an annual thing that the health department does. We visit every single school site in Pima County. We are now incorporating some mitigation plans with that. It is not a scold you if you don't have your mitigation plan in place. It's just to ensure that it's there. Okay. Stuart did post CDC recommends flushing dormant water systems, but we do need something in writing for that, Ms. Steinley. That's a great point. So we're going to get that drafted up with our chefs unit as soon as possible. And then I think what we'll do is we'll distribute that out to the superintendent's group that we have contact with, just so they have the authority to delegate and designate to the individuals that need to know within their respective organizations. Great point, though. Thank you. Okay. That now concludes our 11:30 session at this point in time. Thank you for joining us. We are going to wrap up the call and stop recording at this point in time. I have to jump over